Vortex in LA, and I'm going to be talking about lymphatic drainage massage, what it's good for, who might need it, how often you might want to get it, depending on what you're dealing with in your body. So I have Jay here.
Yeah, for me it's for toxic because I've been eating really crappy food. I feel a little bit, let's say, bad, and we'll see what's gonna happen to me next day after this lymphatic. It's really important for me to do that. Thank you.
Yeah, so the lymphatic system is part of your immune system, and the metabolic waste in your body, or like other chemicals you ingest, like through your food, alcohol, cigarettes, like drugs.
No drugs, only alcohol.
Oh, like medication. They are in your system, and if your lymph nodes are clogged, your body's not processing it really. So when that builds up, it just causes problems in your body, inflammation, swelling, things like that, where just you don't feel good, brain fog, just being tired all the time. You can have swollen legs. Sometimes if it's your legs, they're just real heavy or puffy, things like that. So it's also good before and after surgery. Before surgery, you want to get your body like as healthy as possible to prep for surgery, and then after surgery to help speed healing, and also after surgery, your body's been through a lot of stress, so the hormones and the surgery and everything cause your body to retain water, and it's usually really painful. So it's you help that move along, and after surgery, people are very sensitive, so lymphatic is also very, very light. It's barely just on the skin. You're not pressing down hard. You don't want to get to the muscles, because if you press too hard, if you think of like a tube, if you pinch off the tube, nothing goes through. So that's why you go very light, so you're getting the fluid to flow. And so you have them all throughout your body, but the nodes, your lymph nodes, are basically at like your joints, your big joints. So your shoulders, you have some in your elbows, your hip. A lot of them are here. This is one of the main joints here. You have them in your abdomen. You have them under your chin. About a third of them in your body are in your neck, chin, like face area. So that's also a very powerful place to start if someone has an autoimmune problem. You work just the top first, because you might get a detox reaction. So you clear this first, and then after the detox is gone, you can do the whole body. It's also good for sinuses, because it'll help clear all the like mucus and stuff from your sinuses. And I've done it for a few years, and when I did it regularly on myself, I don't have seasonal allergies anymore. So I don't have to take Zyrtec or Claritin or anything like that anymore.
This is great. Does that help with the migraine? Because sometimes people come and they feel migraines because that something like stuffy inside, like in head. So does that help with migraine and headaches?
Yeah, it can help with that for sure.
There we go.
And if you want to like detox from caffeine or something, help flush it out so you don't get like those caffeine withdrawal migraines or like anything like that. Yeah, it just helps in general, because if you're very sleep deprived too, your lymph from your brain drains while you're asleep. So if you don't sleep enough, it might just, it's going to be all stagnant. So you're going to have even more brain fog because you're sleep deprived and your lymph isn't draining. So yeah, in general, here in LA, people are all very stressed, and stress causes you to retain water, all the hormones in your body. You can get very puffy. When I look at my clients often, even with regular massages, I'll look at them and I'll see like, is their body retaining water? Because I can usually tell if it's from stress or not, and then I'll recommend lymphatic drainage for that, because it can, you lose the water, so you lose weight, and then it's like a cycle, like the inflammation. So like you're overweight, or like you're holding extra weight, you kind of reduce the fluid, and then your body relaxes because it's not as inflamed, and so people are able to lose weight better, and then and they feel better, so then they're able to like exercise and do more stuff, and like can lose weight like that. And especially just because it helps your health, like your immune system. So yeah.
So guys, if you have a problem to lose your weight, this is maybe your solution. You try all different diets and you do any workouts and you can still lose the weight. That's the solution for you. You will see tremendously different on your lost weight. And also if you have a water problem and edema, like a swelling you said, it's also gonna help. And also with the plastic surgery, like if you go through the liposuction or body reconstruction, this is really good to do lymphatic drainage massage and manual therapy before and after, because it's gonna be better go through the surgery, and of course faster recovery after surgery. And thank you.
And I've also heard of people who say, like, before I do lymphatic on someone, we do have the intake form and it asks about medications. So sometimes with detox, if you're not metabolizing your medicine properly, like your body isn't, when I flush it through, you might get the effects of that drug. So some people I've heard that they actually lower their medication dosage after they get lymphatic because their body's able to absorb the medication better. So like they had high blood pressure medication or things like that, and they're able to lower the doses.
There we go. If you smoke weed every day, you should smoke every other day now. I'm just kidding.
So usually when I start a session, I start from the head and neck, and then go top to bottom, and then have them flip over, and then do that, and then come back up to the top. So usually I start right here on the left side to get this left side, which is like one of the main lymphatic drains, and I see if I can feel the lymph nodes. I can feel J's a little bit right here. So this is all the touches, really, very light. You do circles like this, and you want the skin drag. Like I said before, you don't want to push into the muscle, because that'll the lymph won't be able to flow through. So you go here, and then just this way. Most of it's all going towards the heart, so we're above the heart, so we're pulling down. If it's below the heart, we'd be pulling this way. So this is the basic touch here, and even though it's very light, it takes a lot of concentration. I'm constantly kind of assessing how I feel the lymph nodes, if I feel any stagnation, if I need to stay on one spot more than the other. If I do the other side, I'll compare the congestion. Oftentimes, one side is more congested than the other side, so I might spend a little more time there. If it's post-surgery, I generally still do the whole body, but I'll focus more time wherever the area is, like around the where the surgical procedure was done, to help with that fluid buildup right there. I will do it basically as the client needs it and assess it as we go.
Do you use oil?
No oil, because like I say, you want the skin drag. So even I'll use baby powder to make sure it's extra dry. So you don't want to just slide over.
This is great. Is it also fascia work? You work with the fascia also, or just the lymphatic stuff? Do you feel different after you do that done massage? Do you feel like a fascia more like a moving around? You feel more like a released fascia?
Yeah, you can. Some people will, especially just because the way the fascia and the skin are basically together, how it works.
This is great. Fascia work is always great.
Mm-hmm. And I know one specific technique if people want it, or have brain fog. I know how to do the lymphatic for the brain, and then also for the sinuses here.
Yeah, please do this, because I think my brain is stuck, so I need to flush them out.
So usually I make sure I get the head and neck real good first, so it's clear, and then I'll do this one. And one more in. And one last time. Okay. Let's see if Jay gets drunk after that. Okay, what else should we do? So after I do the head and neck, I would usually do the axilla, which is basically the armpit area. So it would be here. I would assess these nodes on the arm here, also here, and then for men and women. So if Jay was a woman, I would just get the towel and I would put it here, and then I would work the abdominal area. So from above the belly button, the lymph, you push it towards the armpit here, and then below the belly button, I push it towards the hip crease. And then usually I'll do a little bit deeper lymph work, kind of working the breath. If it's a little bit deeper, it would work like this. So I would just go with the client's breath, press in, and then basically that. But it should never really be painful at all. Like there really shouldn't be any pain. It's kind of light. I'm just kind of providing light resistance against his breath. And I would do that on the 4 different quadrants of his stomach right there. Okay. And I would just put this back. Okay. And then for the
So our client always have to feel secure, especially women, and this is, like I said, we always never cross the boundaries, so we try to keep you safe and secure.
Mm-hmm. And then, like I said, so the other lymph nodes are basically right at the hip crease. So I'm gonna go here. Usually, I always have the client put their leg kind of this way. I usually just have my clients leave their undergarments on so they feel more secure, and that also gives me a line of where not to cross, because generally it's always right at the hip crease here. So I'll usually say if they've had surgery or something, it'll be swollen here, so I'll kind of assess as I'm pulling the lymph fluid towards the lymph nodes here, and then usually right here I can feel the lymph nodes, and I'll usually do a few circles right on the lymph nodes, depending on how congested they are, to help kind of release it, let it go. And then I'll be doing pulling strokes towards it this way, because so from the back of the leg, the inside goes this way, and then from the outside it goes this way. So I'm pushing it all towards the midline here. Okay, and then what else? How about for the back of the knees and the ankle? Okay, so lastly, the effects that you might have after a lymphatic drainage session. Sometimes it might happen right away, like even during session, if you have congested sinuses, you might start sneezing or feel the drainage right away. Some people, it's usually like when they go to sleep, or when they're gonna go to sleep, or when they wake up in the morning, they might feel kind of extra tired, or like have a runny nose, maybe even kind of feel just kind of sick, like they have a cold. That's normal. It's your body basically trying to fight off whatever metabolic waste and toxin kind of that build up in your body. That's basically kind of a good thing, because you want it all to get out. It just take it easy those days. Maybe if you come and book us, plan it on a day where you can take it easy the next day. So right now we have a promotion, so $30 off a lymphatic drainage session if you want to try it and see how it feels for you. If you're gonna have surgery soon, or if you've had surgery, plastic surgery, lipo, Brazilian butt lifts, things like that, we're here to help you. Click the link below this video for that promotion. And my name's Kiani. I'll be here if you want to book me.